I'm Jim Amos, and this is a Dirty Dozen on decisional capacity assessment. This is my disclosure statement. Decisional capacity is the ability to accept or decline treatment as based on a discussion between a patient and his or her doctor about the proposed intervention. It's determined by a clinician based on a patient's ability to demonstrate specific knowledge about the intervention. A mental health professional is not necessarily required, but can be helpful. Competency, on the other hand, is a legal definition established by the courts. A clinician's recommendations can influence a judicial ruling on competency. The law presumes competence unless otherwise proven. The abilities related to capacity are the ability to express a choice, understand relevant information, appreciate significance of information for one's own situation, and the ability to reason through treatment options. It's always a good idea to reassess capacity when there's been an abrupt change in mental status, which can happen in delirium. And there are other situations listed on this slide in which it's important to reassess decisional capacity. Questions to ask when assessing capacity: as far as understanding, what's your understanding of your condition and what are the consequences if nothing is done? As far as appreciation, what do you really believe about your condition and why do you think the intervention would be best for you? In terms of reasoning, how are you weighing the pros and cons of the interventions? In terms of expression of choice, we've discussed several options. What would you like to do? There should be a higher expectation of capacity threshold when the risk to benefit ratio goes higher, meaning more risk to the patient and possibly less benefit. Common pitfalls by referring physicians requesting capacity evaluations are listed here. One assumption may be that the patient who lacks capacity for one task lacks capacity for all of them, and that's not necessarily true. Decisional capacity assessments are a process, and they're not all or nothing. There are a few reasons for excessive psychiatric consult requests for capacity evaluations from the psychiatric viewpoint, and they are listed here. There are a few others here, and I think that this is a good opportunity to mention that this can go in the opposite direction. For example, a corollary situation can occur when a psychiatrist requests medical clearance for electroconvulsive therapy. It's really important to view decisional capacity assessments as collaborative between specialists in medicine. A psychiatrist is probably better at detecting subtleties of incapacity and identifying treatable forms of incapacity. Capacity assessment in a nutshell. It's about determining if a patient understands, appreciates, manipulates information rationally, and indicates voluntary choice. And it's important to view capacity assessment as a process. It's also important to treat impediments to decisional capacity. And involving other disciplines can be important, such as neuropsychology. There are decisional capacity rating scales, such as the Aid to Capacity Evaluation and the MacArthur Competence Assessment Tool. These are selected references for decisional capacity assessment